Hello, everybody. It's Ron, and it's been a while since I made a video, and I wanted to give an update. Tomorrow, Rose and I are flying to Las Vegas to meet up with our friends and have a last hoorah. Uh, there won't be any drinking. It's been advised that I not have any alcohol, and I haven't in a long time, so I'll be the sober one in Las Vegas. That's sort of a really rare thing, I guess. But it'll be fun. I'm just looking forward to hanging out with some really good friends in Rosa and getting away. Because when I come back on the 3rd, and by the way, I've changed my flight to get back earlier, and thank goodness I did. Uh, because I figured when I got back, I just had to go straight to radiation. But no, 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 no. Yesterday, the oncologist's office for my chemo treatment says, oh, hey, by the way, thought we'd let you know in the 9th inning, we need you to do blood work the day before treatments, each of them. Okay, that would have been really nice to know before, but that's okay. It's sorted and we're good. Don't expect radiation and chemo departments, these facilities, to magically make this just work. You have to be diligent. You have to make calls. Yes, my UCLA health portal gives me information, but sometimes not in the fastest manner you might think it should or could or would, but that's okay. Everything's settled. At this time, it's 5 chemo treatments every Tuesday, and then radiation Monday through Friday, beginning Monday. Yeah. So I get off the aircraft. We get back in around 12:15, and then on the way coming back toward Westlake Village, Thousand Oaks, I get to text a message to one of the facilities where they will do my lab work. They'll draw blood, and then either hang out in the area. And at 4:45, I go to my first radiation treatment. Yay! And then we go home. I think that's going to be the case. And once we get home is when we will have the talk with the girls and let my daughters know, who are 13 and 11, what's going on and sort of what to expect. So that's cool. How have I been? Well, I feel pretty good. Mentally, certainly much better than I have been. Getting results of the PET scan, that was awfully good, but then you make the mistake, you go down the rabbit hole, and you look at your report, as I did yesterday for the first time. The report came in from the PET scan, and when you hear certain terms like extreme or rapid, or certain adjectives that paint the story, you're like, wow, it's really aggressive in there. Good thing I'm going to get some treatment, and that'll be fine. But I want to tell you kind of a cool, fun story about my speech pathologist, Carol. Okay. She's really, really cool. One of my favorite doctors. I mean, Dr. Abelson, he's way up there, and my ENT, he's really cool, but I've only seen or talked to him a couple times, right, in all of this ordeal. But Carol, she's just fun. And she allows me to be me. Well, none of them have a choice, but we really have had fun, and it's super educational. And so if this crap ever happens to you, I think it's very important that you ask your care providers to get you into a speech pathologist. She's not trying to teach me how to speak. She's teaching me, and sorry, this is the last week with Invisalign, so I stopped speaking with that lisp. She is teaching me a lot of exercises for my neck, for my throat, and my tongue to help prepare me for what's going to happen around 3 weeks or so into treatment. And everyone knows it's ugly. It's going to be fugly. It just is. There's no way around it. But through her guidance and education, I'm learning about the types of foods that I can eat now, and what I should be careful with now, and what I'm going to be limited to potentially later. But the tongue exercises have been really funny, and I really caught her and Rosa off guard a couple of days ago when we were there. She was teaching me this like tongue up, over, down. They call it the cross. And I said, damn it, Carol, it's stuff like this that got me into this place. And she just looked at me really funny. And Rosa started laughing. We just all had a big laugh. So that's cool. I also went down a rabbit hole, and I'm going to suggest that you use extreme caution if you do this. I've watched a lot of YouTube videos on what I might expect. And of course, when you start watching YouTube videos on anything cancer related, everything starts popping up. And some of these terminal cases came up. And I made myself watch some of these. These were people that were leaving videos that have died and wanted the video to be released after their death. And some of these were videos of people knowing they're going to die in a week, 3 weeks, a month, maybe a year. Brain cancer, lung cancer, all sorts of things. And I went down this rabbit hole and I'm thinking, holy moly. I mean, that's bottom of the barrel. I mean, you've hit the bottom now. That's a whole different level of distress. And I had to say to myself, you know what? I make fun about calling my cancer the paper cut version of cancer, and I still, in my heart, believe that's what it is. And there could be all sorts of weird repercussions. My vocals could change. I lose loss of taste, and maybe lose a bunch of weight and just be miserable. But I'm going to hit it head on because I'm in control. The cancer is a temporary thing. At least that's what we're trying to make it. But I'm in control of what's up here. And this is already decided that I'm just going to sort of beat the shit out of cancer because I know who I am. It doesn't know who I am. So you have to have that mental fortitude to go forward. So bring your best game on because you're not going to win. It's just not going to happen. Not with what I have. The second thing is a guy that I've watched for years. He's a cycling coach. He's from Scotland. And he's really funny, and he always talks about the mental attitude when training and when racing. Well, he has colitis, and he was recently diagnosed with some pretty severe issues. And he's in the hospital, and he's putting his best foot forward. He's talking about his issues, but he's still coaching. He's still telling people, remember what we talked about. And that's a horrible Scottish accent, but that's the best you're going to get. Remember what we talked about from the beginning. It's all preparation. Remember, it's up here. And I'm seeing in his eyes, what he's saying, what's in his eyes, they're not quite the same. I see concern in his eyes. I can see that, but I can see him battling it, pushing through it. And he's in the hospital. He's going to be in the hospital for a while. And they don't know exactly what's really going on with him, but he's pretty backed up. And it doesn't look, I don't want to say it doesn't look good. He's in trouble. Okay? I'm not in trouble. I've got great care. They know what this is, and they know how to take care of it. I'm okay. I'll be okay. This will be an inconvenience for me for a few months. Will it take months to recover? It could take 6 to 7 months before I'm like feeling completely myself. My goal is to try to make that 3 to 4 months. So I'm doing my exercises, I'm walking, I'm eating foods that I can eat and trying to keep the calories in. I probably should be forcing myself more calories. I'm not being too risky, but I also have a certain weight I want to be at, and then the goal is to maintain that through this whole process. All right, we're at 9 minutes. It's way too long. Maybe I'm gonna have some video from Rosa and I in Las Vegas with our friends and just having a good time. So I'll bring that to you later, but for now, just know everything's on track. I'm super mentally fit for this and anxious to get these treatments on the way and experience that whole thing. All right, we will catch you later. Be good.